Good morning, ladies and gentlemen. Hope has been the savior of mankind throughout our history. It serves one message to everyone. It is a lifeline in adversity and a passage of light that shows how, even in our darkest moments, one can heal with positivity and optimism. We must put this hope to work. The Times of India's A Shot of Hope serves its readers all the credible information that will help them find hope and heal from the best doctors and experts in the country, and provides a platform to find their answers to the COVID situation in their homes. I am Sanjeev Bagai, the Times of India brand director, and I would like to express my gratitude and welcome to our panel of experts, Mr. Amitabh Kant, Mr. Mohandas Pai, Dr. Anant Bhan, Dr. Santosh Shetty, and the moderator, Dr. Sanjeev Bagai.
My many thanks to Mr. Sanjeev Bhargav, who's the brand director of Times of India, for initiating this virtual panel discussion on A Shot of Hope. It's to bring about medical scientific information in a correct platform with the best intellect minds available in India, to give a correct and a more accurate scientific purview on the vaccinations, the effect of vaccinations, and the Indian healthcare system, focusing on the Indian infrastructure which is required to enhance the growth of the medical systems in India. We have within us a very powerful panel. I would like to introduce Mr. Amitabh Kant. Mr. Amitabh Kant is perhaps one of the finest intellects we have in India. He is the CEO of Niti Aayog and spearheading various initiatives, not only in COVID, but beyond COVID. I welcome Mr. Mohandas Pai, extremely respected name, not only in healthcare, but in the financial and the economic world. Before joining as chairman of Manipal Global, Mr. Mohandas Pai was a member of the Infosys board as director and head administration, education, research, finance, human resources in the Infosys group. I welcome Mr. Anant Bhan. Mr. Anant Bhan is a very well-known figure in research in the medical sphere and bioethics. He is an adjunct visiting professor to the university in Mangaluru. I welcome Dr. Santosh Shetty. Dr. Shetty is the CEO and executive director of the Kokilaben Dhirubhai Ambani Hospital in Mumbai and has been involved in hospital operations for the last 20 years. Mr. Kant, we've seen perhaps the worst of the pandemic is behind us, but obviously we have to keep our guard up, and the hope for the future, and hope in every sense, hope of livelihood, hope of life itself, hope of saving lives in future is really the vaccine. But coming to what we have seen in the last 18 months or so, we've heard a lot on various platforms on the amount of work which has been done and accomplished by the government to increase the bed infrastructure, the capability to manage a large avalanche of patients which come in a burst, the manpower resources, including how we handle the huge crisis of oxygen. I mean, heaven and earth was moved together to make sure oxygen reaches, because no one had ever seen this kind of burst of patients in our lives earlier. So what is your take on how we have moved forward in the last, say, 2 years or so, and what is your vision for the future?
So thanks. First of all, I think it's very important to realize that this is not just a pandemic. This is going to become an endemic, and therefore India needs to build up its own manufacturing capacity for the vaccines. We need to be in a capacity to make close to 300 million vaccines a month, because we need to vaccinate our population every 4 months. And even if we have excess capacity, we should be able to export the rest of the vaccine. And therefore, a huge amount of ability to build domestic manufacturing capacity needs to be built up in the coming days. And this requires a lot of hand-holding, which the government is doing. It requires a lot of tech transfers, and it requires a lot of advance orders to these manufacturers, which the government has already undertaken. Secondly, my belief is that health has to be brought truly center stage in all the states of India, and particularly states of the northern region of India. And the entire emphasis has to shift on providing primary health care. And one of the key emphasis has to be to make top-class health and welfare centers at the grassroots level. And the Prime Minister's Ayushman Bharat really aimed at that, creation of health and wellness centers at the grassroots level, because prevention is better than cure. And the entire emphasis has to be on primary health care. And therefore, my belief is that a huge amount of work needs to be done at the state level, because essentially we need to realize that health is a state subject. Thirdly, the government of India itself, through the PMJAY and through the Ayushman Bharat, have used insurance as a means to lift people above the poverty line, because in India, 66 lakh families go below the poverty line simply because they're not able to take care of tertiary care. That's why we built up the world's largest health insurance scheme for catering to 500 million Indians. That's more than the population of USA and Europe put together. And a totally digital scheme where you can be from Bihar moving to Tamil Nadu, you carry your health insurance with you. And therefore, my view is that you need to provide a layer of digital technology. Health will take off in India in a very big way if we use technology to leapfrog. That is the crux. Use your basic framework of Aadhaar, mask it because of the Supreme Court judgment, mask it on the front side, but use that in a very big way to spread your digital health mission and make digital healthcare totally interoperable across India. Across, everyone must have a digital health identity, every doctor, every nurse, every patient. And once you make it interoperable, you will make a quantum jump forward as far as healthcare is concerned, and you will ensure that you are able to provide healthcare at a very minimal cost across the country, and use in a very big way technology will make you drive that. And fifthly, my personal view is, much like the production linked incentive that we've carried out to make a quantum jump in manufacturing across key manufacturing area, we need to move away from generic to very high value-added manufacturing in the pharmaceutical world. And there we need a research-linked incentive scheme. Pick up 4 or 5 of the key areas: complex generics, biosimilars, what have you, and 5 or 6 areas. Make Indian pharmaceuticals the manufacturing champions of the world through a research-linked incentive scheme, which will enable them to move into cutting-edge technology in the pharmaceutical technology. So my view is, firstly, strengthen primary healthcare. That's the crux. Secondly, use technology in a very big way. And thirdly, move away from generic to high value added. And that will enable you to drive India's pharmaceutical industry. And fourth, all this blending together across will actually make India, enable India to provide healthcare to its citizens at the right price points and enable India to become a global champion in the pharmaceutical industry.
Can we have our own MRI, CTs, ultrasounds manufactured here? A cost of machine which is costing us landing costs of 12 to 13 crores, our manufacturing cost will be less than 3 to 4 crores. That cost benefit can be handed on straight to the patient. Your comments, please.
So one of the key things we did when we were devising the production linked incentive scheme was not merely to look at pharmaceutical sectors, especially APIs and key supply materials which are imported in a very big way, but also to look at medical devices. And we said India must become a champion in medical devices because the imports are of a very high order. And India is totally dependent on external supplies for medical devices. And therefore, the production linked incentive came up for this. But we've also looked at establishment of 4 different manufacturing zones for medical supply, one of which is the one in Vizag, the AP Medical Zone, which has done some phenomenal work. And I would request all of you to go and have a look that in a very short time, it has demonstrated India's ability to do very high value-added manufacturing of medical devices. And almost all the top manufacturers in the world actually are doing value-added manufacturing in this zone. Based on the success of this, I think we should replicate this in 3 or 4 other manufacturing centers. They need not be based on regional geography. They should be based on where we are able to attract the best manufacturers of the world to manufacture. Eventually, It's about making India the manufacturing hub of the world in medical devices rather than just importing them. India provides a huge market. India provides a huge competitive strength to these manufacturers. And I think there is a massive possibility of spanning out what we've learned, the huge evolutionary process that we've gone through from the AP medical zone in Vizag, and we can replicate this model in 3 or 4 other zones. This would require a lot of handholding, but I think this is a must for the future because we can't be totally import dependent on the medical devices.
Dr. Bagai, I think we should leapfrog the earlier generation. Remember, MRI and other technologies have been there for 15, 20 years. Yeah. Now we are in the midst of the digital revolution. You know, the LIDAR technology, which is the technology which can send sound waves into the earth to find out, you know, whether there are any structures inside the earth, has revolutionized archaeology. Why can't we use LIDAR technology, digitization to create new age medical devices using artificial intelligence and big data? Now, the way you do medical science and the way you use this kind of medical equipment has changed tremendously. I would suggest to Amitabh Kant that why doesn't he pick up 5 areas, robotic surgery, MRIs, and anything else, a diagnostic, whatever it is, and create a grand challenge and invite all young entrepreneurial companies to come and bid for the grand challenge and give a grant of 5 crores to anybody who is successful among the top 3. For example, when we had this ventilator shortage, government did exactly that. And once you give this grand challenge, people come up with something, you must give them money or place an order to buy 1,000 pieces. If you buy 1,000 pieces and give it to the public hospital, which government has to do to upgrade, then immediately you create an industry, right? Let us leapfrog technology. Why do incremental change? Digitization has changed the way we do things. I think many of us are unaware of the kind of revolutionary things that is happening with startups and with healthcare companies which are using big data, computing, cloud computing and huge capacity, AI, etc., to rethink and reimagine how healthcare devices should be. I give you the example of Dozy, which creates a mat which will be put under every person's bed, which can now collect data about the vitals of every human being every single minute and transmit it to an app which is in the mobile of another person. Now the entire data can be put into a display next to their bed, and that can become the equipment in the ICU. So we must reimagine. Let's have a grand challenge. Let us think of something new, and we have the basic ingredients to do all this. I think that should be the way out for Amitabh Kant.
How can the private large corporates percolate the healthcare, especially the preventive healthcare, early diagnostic care, into tier 2, tier 3, and indeed into the villages which are close to your centers? How can that be initiated more?
Doc, my personal feeling is it has to be a public-private partnership. First, we must make sure that public healthcare expands. In 500 districts of the country, we must have a 500-bed tertiary care center expandable to 1,000 beds in case of a pandemic to be the core around which things can be built. Then the private sector can come in and build smaller hospitals all around in a district. And then for the PHC, which are very critical, India has 5,600 talukas. Maybe 75% of them require more PHCs at the rate of 5 PHCs per taluka. I would suggest that the private sector, charitable trusts like Premji Foundation and others, Reliance Foundation, Infosys Foundation, come in and adopt the PHCs and build them. But please, you know very well that management of a healthcare facility is more critical than the money. People can pour money, manage it. I would suggest, Doc, we should have a very novel initiative whereby the 600 medical colleges that exist in India are asked to adopt 5 PSCs each, and maybe 10 PSCs each, where students can be sent, doctors can be sent, and they can manage it, funded by the private sector. So if you have a public-private partnership where the private sector works with the PSCs, work with the medical colleges which have human capital, and does it in the villages and smaller towns along with the government, I think it'll work. Because we need human capital, we need financial capital, and then we need management. And all 3 are scarce in the government sector, but government has to expand public health infrastructure. But through a public-private partnership with philanthropy, with private people spending money, and the education sector or the human capital sector working up, I think we can manage it very well. I think it's possible. Like the PM called for PM Care, he must make a call that all charitable institutions should come and adopt maybe 4 or 5 PSCs for a matter of 10, 15 years. And I think that could do the trick.
Wonderful. I think it's an excellent thought. An excellent thought. We must carry this forward. Mr. Dr. Anant Bhan, what is your vision on public healthcare improvements? What can be done to enhance data, especially from an epidemiological-based accurate prediction background? And we've seen so many predictive charts and graphs on the media ever since this pandemic started. And very often people don't make sense of it because there is so many curves going up and down. So how can we make, as a common person in India, how can we make sense of the graph's trajectory as far as the predictive value in an epidemic or pandemic is concerned?
Excellent. Thank you so much, Dr. Bagai, and thank you also to the Times Group for having me. So, one of the things we need to learn from the pandemic is what it shows us about the health system. And of course, we have a very diverse health system with a long history, both with the public sector and the private sector. But we also know now what our deficiencies are. They've become very clear during the last 1.5 years of experience. So, of course, it's very clear to us that we need to invest more, but the investments also need to be diversified. So, a lot of times it's easy to talk about the ICU beds, the ventilators, the machines that we need to buy and install in our facilities. But it's equally important for us to talk about the human resources to run them. Because you cannot manufacture doctors, nurses, trained paramedical staff overnight. You need to plan for that in advance. And that is where the short to medium to long-term planning becomes important. The other issue here, I think, is that, one of the major reforms we've seen in the recent past is Ayushman Bharat. And unfortunately, in public discourse, what we've ended up doing is focus too much on the insurance part, but not so much on the role that the health and wellness centers could play, because they are really a transformational change in primary care in this country. When you focus on preventive care, promotive care, then you are also trying to reduce the burden downstream for curative care, which is what we should be aiming for from a public health perspective. So I think that is extremely important for us to also focus on and ensure that we get our health and wellness centers up and running and functional as soon as possible. To your point around epidemiology-based predictions, I think that is extremely important, but for that you need a few things. One is sound data. You need to have that transparently available, and then you need trained epidemiologists to interpret it so that you can act on it. Just yesterday, I was on a TV panel where, a panelist made a very interesting point. He was talking about unlock and the decisions around unlock. And he said, unlock should not be driven by date. It should be driven by data. But data will only work when it is available and interpreted and acted on immediately. If we have survey results being shared 4 or 5 months down the line, then it's nice from an academic perspective, but it cannot help drive policy making. So again, that's why we need trained epidemiologists who can provide us with that analysis based on good quality data coming through all the way from sub-district level, and that being analyzed. And this kind of capacity should be available in the academic sector, in the public sector, in the private sector. So hopefully, the pandemic teaches us that. And though the graphic predictions, I think we've had some really good data modeling, but sometimes it can be too complex. So I think we also need, experts in public communication who can break down that data and help it to be absorbed both by the lay public, but also policymakers, so that we have quick, follow-up action because of that. Thank you.
Wonderful. Dr. Shetty, based in Bombay, give us your vision on how private hospitals can build a model of more affordable and possible smaller healthcare centers, and how can we actually take the present pricing of the private hospitals to become more uniform and functional? So, 2 quick questions to that. Please go ahead.
Thank you, Dr. Bagai and Times of India for having me on this panel. One of the things that has clearly got amplified in this pandemic is lack of adequate beds. I mean, we've kept discussing about how India needs 2 million more beds at the earliest. And the point here is that where are these beds going to come from and where are they going to be put up? And clearly, taking hospital and healthcare into the community in the form of smaller hospitals, which could be in the range of 75 to 100 bed hospitals, is definitely an option to look at. Like you rightly said at the beginning, that close to 70% of private healthcare is being provided by some of these smaller setups. And most of these are 10 to 20 bed setups, which are run by individual doctors. So there is a huge opportunity for private healthcare players, organized healthcare players, to go in there and set up some of these facilities. The 2 big challenges in this, of course, is going to be, one is how do you make these facilities viable with the scope of services that you provide. As organized players, there would be an expectation from the community that you have good quality diagnostics, CT scans, MRIs, cath labs. So how do you make sure that you come out with innovative models where the cost of creation of these facilities makes it viable? The second very important point, which both Mr. Pai as well as Dr. Bhan stressed upon, is the availability of adequate human capital. Availability of doctors, nurses, paramedical staff to run some of these hospitals is also going to be a big challenge. These are the two important points that we need to focus on. While there is a huge opportunity and great potential, we need to, as private healthcare players, come out with innovative models which will keep the cost of creation low, as well as make sure that adequate human capital is available to run these facilities.
Sharing of human resources.
Second point is on the pricing, which you mentioned. So clearly, that's one thing, in terms of private healthcare, is both all healthcare actually is both highly capital intensive and labor intensive, and we need to come out with innovative models where the cost of delivering this healthcare can be kept as low as possible. And from the patient point of view, we need to figure out schemes whereby the out-of-pocket expenses can be reduced significantly, whether it is through Ayushman Bharat, community health schemes, CSR funding, corporates contributing. All of these together will combine to make sure that we bring down the cost of healthcare down and also improve the affordability for patients.
India has various verticals: industry, manufacturing, healthcare, road and transport, and so on. Of course, all the verticals, including healthcare, are supported by the tax each citizen pays. And India, as a country, the people less than 2 to 4% are paying income tax and supporting the other 95 odd. Can we link either Aadhaar or a universal healthcare card to access healthcare? Because then that's your largest fishing net to make people pay taxes, to improve health infrastructure. Because infrastructure will need money, and people, I feel very strongly, must pay their taxes.
Doc, I think, I wouldn't agree with that approach that people are not paying tax. People are paying tax, but, let me give you some data. We have 138 crore people. 100 crore people earn less than $2 a day. All right. So they are not the tax paying class except for GST and indirect taxes. You've got 38 crore people. 8 crore people pay income tax. All right. 8 into 4 for a family is 32 crores. The problem is people who have business and profession don't pay the right amount of tax because they can, they take money in cash, they do some things. So I think this idea enough people don't pay tax is not there. What we need is a public-private partnership. We must insist that the basic infrastructure for healthcare across all districts in India should be public. There must be an overlay of private, and then there must be a digital infrastructure on top of that to get connected. We must remember, 100 crore people are very poor. They can't afford to go to a private hospital. They require care. Ayushman Bharat is fantastic. It'll take care of the great majority of them, and that's going to remain. And the second thing you must remember, Doc, the cost of this is not very high. For example, we estimated that to build a 500-bed hospital in 500 districts, to create 250,000 beds across India in the next 3 years will cost you 250,000 crores. The government of India and the state government spend 60 lakh crores a year. 60 lakh crores. Spending another 50,000 crores a year for the next 3-4 years is not going to hurt them at all. Yeah. This year, the health budget has gone to 2,25,000 crores. And the last point, why we require public infrastructure and then private, is the fact that today, about 13 crore people are above the age of 60. By 2030, this 13 crore could possibly go to maybe 25 crores. We are entering an age in India where we're going to have an ever-increasing number of older people above 60. They require healthcare. They require physical healthcare too. It cannot be all digital. So we require a massive investment. The money is there. Doc, the last point, remember Prime Minister Modi said, I'm going to give good drinking water to everybody. And he put 60,000 crores into the budget this year. Now, if you ask somebody, where is the money? I mean, the money is there. 60,000 crores is put into the budget this year. And by 2022 or 2024, every household will have good drinking water. Why can't we have a program like this for a massive upswing over the next 3 years to put health infrastructure, create human capital, change of policy, and make sure that we take this. And he can take the decision, and there is enough money, Doc. Money is not the problem. It is the will, the mindset.
A lot of the private hospitals are gauged by FAR. That means how much you can build in what land quantity. Now, FARs differ from Mohan in different cities, depending upon where you are in India. There has been a difference between Delhi and Bombay, say, for example, or in other places in South and East. What is your take? Why can't the FAR be relaxed? Because the building remains the same. You can build a little bit more. You can have more number of beds, because what is scarce is prime land in an accessible location.
Doc, I think there's a brilliant idea. In developed countries, you don't have the concept of FAR, you have the concept of setback and safety, and you can build what you want. And like you said, our urban policy of having a very distributed city is actually very bad for the environment and bad for people. You know, cities should be concentrated hubs of human activity. That means cities should go vertical with safety being kept in mind. And this idea of having an FAR which is quite low makes cities get into urban sprawls, which expands cost. So I think US is a brilliant idea. The government must allow urban hospitals in cities to expand with going up, depending upon structural stability and safety and capacity, maybe twofold or threefold. I think it's time for us to change all the norms that will reduce the cost of hospitalization, reduce the cost of real estate, and make it much more viable. I think the brilliant idea and improve access.
Okay, and the second question to you, Mohan, question which is closest to my heart forever. How much should private hospitals and indeed government hospitals, and I will not say spend as expense, but I would use the word invest, because it is purely and truly an investment into technology, especially digital platforms, and how can that help in our connectivity to places which are otherwise health-wise inaccessible?
Okay, another brilliant question. The pandemic has shown how the digital revolution has arrived with a bang. India has very good telecom network. All villages and cities, to the extent of 98% of the landmass of India, is well connected. We have almost unlimited bandwidth for 100 rupees a month. So now there are a lot of digital technologies that have come up that can solve this kind of problem. For example, a startup called Dozy in Bangalore has set up a mat with IoT devices which can be put under every bed to make it into an ICU. It will monitor your heartbeat, your blood flow, your temperature, your breathing, and take all this vital data and put it into a mobile phone to a doctor who could be away. So a nurse could handle 10 ICU beds at the same time looking at all the data. Then you got teleconsulting, which can work with everybody else. Then you got apps on the mobile by which, people can see your eye, people can see your tongue, people can see everything else, and they can monitor and everything else. So all the vitals can be done, diagnosis can be done. What India requires now is a digital infrastructure as an overlay on the physical infrastructure, especially in remote areas, to give access to you. Now, I want every Indian to be able to consult Dr. Bagai. But can we produce Dr. Beg? 100 Dr. Bagais, 1,000 Dr. Bagais is not possible. What can Dr. Bagai do? Dr. Bagai can be connected to all of them through a telecom, to a telemedicine network, right? And now one more data says the super specialists are engaged only 35-40% of the time. Now, what the pandemic has done is, because the Indian Medical Association regulators allowed telemedicine, it has expanded tremendously. What could not be done earlier has been done now. And I think we must have an overlay of medical technologies and apps all across India to enhance the quality. So we build physical infrastructure, we have an overlay of digital infrastructure, and both can make a tremendous difference and improve productivity and lower costs all across.
Wonderful. Way to go forward. Dr. Bhan, again, a topic which is closest to my heart, and I keep writing on this every day. What is genomic sequence? What does it make sense to a common person? Why is it important? What is the new terminology now of WHO of alpha, beta, theta, delta? Now we see the delta strain of B617 type 2 being more dominant in different parts of the world.
Thank you. So I think that's it's an important question, and I'm glad, Dr. Bagai, I follow your Twitter feed. I know you keep pointing that out as being an important area we need to focus on. And we need to remember that this kind of expertise in India is important much beyond the pandemic. So it is not just for COVID-19. We actually need for a whole lot of other areas, including tuberculosis, malaria, newborn screening, just better prediction. I think we are now in a world where the role of genomics is extremely important. And actually, quite honestly, India is already making some inroads here. If you look at the Department of Biotechnology, they have invested in setting up clinical genetics capacity. They've started courses all over the country where clinicians are going in and doing 6-month fellowship. So that's a great start. We've started working on an Indian Cancer Genome Atlas on the model of the US, where there is a large NIH funded Cancer Genome Atlas. But of course, we need to do more. And the reason is once you have a good handle on the genomics, gene sequencing, then not only for viral pandemics like what we are having right now, that you are able to track very quickly the kind of variants which are coming through, and then also try to understand if there is clustering happening, how are they interrelating with your vaccination program? Do you need to do any changes in the way you are approaching your vaccination, in the kind of vaccine mixes that you're using, and can actually very much help in our public health response. But to actually do that, what you really need to do again is a lot of capacity building. So of course we need more institutions. We talked about, we do have an INSA-COG at the national level, but national level capacity is not enough. We saw that early in the pandemic where testing was very much focused on a few national labs. We need this kind of capacity at the state level, and state governments and the center can invest in it. There's actually a lot of the role industry can play there as well. You need partnerships with industries. These labs can also provide services which can be used by, of course, hospitals, but also the industry. There are good examples of bioscience clusters like you have in the National Capital Region. You have those in Pune, Bangalore, but we should Hyderabad as well. But we need to have them in Bhopal, in Guwahati, in Kochi, all of the other areas where we can build this kind of capacity. So if we have excellent institutions, we have the right human resources, a hub and spoke model, then I think we can do great on genomics. And that is where certainly one of the future for both healthcare and sciences, we need to take that lead now as a country.
Absolutely. Just to summarize, I think it's been excellent to have all of you all on panel. It's been delightful. Of course, India has gone through perhaps one of the worst phases post-partition. A lot of economic and social turmoil, a lot of personal family losses of near and dear ones, and including family members. But I'm sure all of us collectively with solid solidarity, we will come out of this crisis. There's no question about it. In spite of all the flack India has got nationally and internationally, we still have, and taking into account, and Anand being an epidemiologist and a number man in healthcare will bear me out, that the undercounting as far as underreporting has been across the globe. It's not India-centric, but still India has, compared to US of 1,800 deaths per million, France 1,680 deaths per million, Germany 1,060 deaths per million, India has 249. So I think it's the versatility of Indian healthcare, it's the will of the leadership. I think it's a collective responsibility of the society. We must become, all of us, brand ambassadors for the vaccination campaign. I think each of us should carry it on our sleeve, in our heart, in our mind, that we will promote the vaccination campaign, because that's the only way, one, to suppress the third wave if at all it comes, and two, is to suppress the chain of transmission so that we can come out with least amount of damage in this pandemic. And last, most importantly, like I've always said, we have an RNA virus which is hugely mischievous. Let's make mask our DNA. You prevent the mask, it's your best and the only barrier to prevent death. Wear a mask, become a vaccine ambassador, be a movement, be a part of the movement of this huge campaign of healthcare, because health is not the state subject. I always say health is neither a central subject. Health is an individual subject. We have to look after our own health, because the strongest link in the chain is our weakest link. If we don't look after the society, we will not look that strong. Thank you everyone on panel. It's been absolutely delightful. Mohan, Anand, Santosh, and of course Amitabh. Thank you everyone, and thank you the organizers for giving us this opportunity to share our thoughts. Thank you so much.